I'm pleased to tell you that your headaches are nothing serious. The CT brain, the lumbar puncture and the blood test have all come back unremarkable. Now, although your headaches are severe, it means there's nothing seriously wrong with your brain. Now, your headaches are most likely migraines because they're in one side, they're throbbing. Now, there are 5 types of migraines. Migraine with auras, which is when you get flashing lights, floaters, zigzag patterns with your headaches. Just standard headaches without any auras. Headache in the back of the neck, called a cervicogenic headache. Vestibular migraines, which are headaches with dizziness, nausea and vomiting, or hemiplegic migraines, which are headaches associated with numbness, tingling, weakness and heaviness in one side of the body. Now I want to share some tips for how to best manage migraines. Number 1, make sure you don't take any recreational drugs such as cocaine, cannabis, heroin or alcohol because they can seriously trigger headaches. Secondly, there's plenty of reassurance that migraines can present in a thunderclap sudden onset fashion called a thunderclap migraine. They can also last for longer than 72 hours, which is called a status migraine. Now you've come to the right place in a hospital to be investigated to make sure it's nothing serious. Thirdly, is to start with simple measures. Remember to stay stress-free as much as possible. Stay well hydrated with water, not alcohol. Now, when you feel a migraine coming on, take simple painkillers that you can buy over the counter, such as paracetamol and ibuprofen. If the migraine is really serious, you can take paracetamol and ibuprofen together. Take the painkillers, lie in a quiet dark room and rest until the headache subsides. This prevents the dislike of lights and the loud sounds that might make your migraines worse. Now, most importantly, keep a headache diary. In this diary, for the next month or so, every time you get a headache, you're going to write down what you were doing at the time, what you did that might have made it worse, what you did that might have made it better, how long it lasted and how frequent. Now, over the next few weeks, you may notice a pattern. Migraine is specific and different to each individual. Almost anything can trigger migraines and is very different for the person. What works for one person might not work for the other, which is the importance of a headache diary to see what works best for you. Now, in a few weeks to a month's time, despite the headache diary, despite the simple measures, if your migraine attacks are still frequent, 1 to 2 attacks per week, then go back to see your GP or your doctor. They will prescribe migraine-specific treatment, such as triptan for migraine attacks. They may put you on medications such as beta blockers, amitriptyline, topiramate, candesartan to prevent migraine attacks. Now, I hope you feel better soon. And if you do feel better soon, don't forget to subscribe!